Do you keep records, statistics, of the amount of requests for mental health services for youth at risk? Do you keep records of how many are denied? And do you have records of what the delay rate for treatment is?
Yes, to answer the question, our department does, have records of, people requesting, for mental health services, and the department does actually provide through contracts, those services by contracting with professionals to actually provide those services.
Okay. We had your chief executive director at committee, and I asked him that question. He said, of course we track. Of course. If they need service, we track that. I said, would you pass those records over to our committee so we know? Is this hearsay or not? And he said he would. So that's committee testimony is like speaking on the record. You have to be truthful. But when I asked your department said they don't track. So just because you don't track children that falls through the crack doesn't mean you're not responsible for them. So my question is how can you then make any kind of financial planning if you're not actually tracking the denial rates of children who are needing these services? If you don't track, how do you know?
It is my understanding that any requests that are made that there is a tracking mechanism to respond to those, and if there's evidence to the contrary, I look forward to hearing that. I can perhaps ask
So would you I don't need names, I just want to know what are the percentages, because I note that in terms of denial rates in special orthodontics, it's gone up to 99% appeals. Now we have that on record. Why don't we have the denial rates for children needing mental health services who are facing potential risk of suicide? Do you have it or don't you?
I'll ask Sunny if he wants to comment in terms of whether that's available.
So the access to mental health services, I believe you referred to the mental health services under the non-insured health benefit. So every individual that is a First Nation or an Inuit person have access to coverage for a certain number of sessions every year. So
yeah, I know, but
theory,
people are told time and time again that it doesn't exist. So I asked your official, do you track? He said yes. Do you have the statistics? He said yes. Then I said, would you give them to us? And he said yes. So we contacted your department and we were given a letter saying you don't have any of these records. So how can you tell us that you're actually looking after these children if you don't bother to track and yet you tell our committee that you do?
If I can answer this one, we don't track denial because under this program, everybody is eligible.
So everyone's eligible, but if they don't get served, then they fall through the cracks.
But the service is coming from private provider. We don't necessarily have a tracking of if people have asked for these sessions or have seen the providers. We confirm that we will be covering the cost.
That's like a form of systemic negligence if you don't actually know.
Fred will have to leave.